Los Angeles is finally making news. We haven't heard anything crazy going on from that city in a very long time, but finally, the city of Los Angeles is in the news. The Children's Hospital of Los Angeles is closing its Center for Trans Youth Health and Developmental and Gender Affirming Care Surgical Program. Thank goodness. Let's bring our panel back. Amber Duke of the Daily Caller, Andrew Gruel, chef extraordinaire, guys. So this, Amber, I thought this was really interesting because the reasoning that the hospital is giving is that Trump's executive orders was going to strip funding for them. Hospital officials say without that funding, the hospital will only be able to stay afloat for 50 days. I personally would love to see people back off this transgender mania stuff because they've come to some sort of moral realization, but at the same time, I'm not mad about the fact that hitting their wallet and their budget is also effective. What are your kind of thoughts to societally speaking? Is that how we want to attack this stuff, or is this an effective way to go forward as well, hitting them in the wallet?
Well, I mean, ideally, these people would actually read the science and realize what they're doing is so harmful to kids, but they're so deluded that unfortunately, I think political force is the only thing that's going to work for a lot of these people. So I think Trump's EO is a great way of getting at the issue. Look, Republicans for a long time have been sort of reticent to use government power, and Trump has sort of flipped that on its head and said, the left does it to us all the time. We're going to take advantage of the avenues we have when we have them. And so I support it. And by the way, a couple of months ago, I decided to call a bunch of these hospitals that receive federal funding that have transgender clinics to ask if they were still taking youth patients. And a lot of them were openly defying the executive order. So I have a list
Hmm.
together at the Daily Caller. Hopefully, the Trump administration will use it so that my work doesn't go to waste. But man, it was so hard on the phone to not just yell at these people and tell them how ghoulish they were.
Well, yeah, more power to you because I probably would have flown off the handlebars if I were trying to get that similar information. Andrew, the idea of kind of like libertarian laissez-faire-ish with or actual conservative policy. Amber kind of touched on it. Libs use policy to actually make us do things. Conservatives are usually kind of like, let everybody kind of do whatever they want. And we're going to stay out of it. It seems like we're kind of turning a corner, making conservative policy actually do something. And if this is the effect of it, that's kind of hard to argue with. What are your thoughts?
Yeah, definitely. But this all comes back to money. I'm always going to look at this broadening the
Mm,
scope from a business perspective and a financial perspective. You see, this underscores the financial disaster that the medical system is in California, especially, and many of these blue states, because we know that the way in which Democrats view the medical industrial complex is completely upside down and is only going to lead to more bankruptcy, right? This idea of like free Medicaid for free medical for all, that's absurd. They've used this kind of trans issue as an outline issue to try and raise more funds, but they've come up against the federal government now. And that reason that that's important, and we don't even need to wax on about the fact that this is just an immoral issue altogether. I think most Americans actually do agree with that, and probably many of the doctors that are associated with this also agree with that. But what this shows you is that how much money was coming from the federal government into the
yeah.
states and into these hospitals that shouldn't exist. Kind of a Dojian approach to this. And really, we need to flip the system upside down from a financial perspective.
Yeah, no, that's actually a very good point. Talking about the finances of it.